Hey everybody, welcome to Autism Awakening, a podcast that helps you help your child with autism. My name is Dr. Jared Skowron, and I'm an international biomedical autism doctor of 21 years, and I host this podcast and have for the past 6 or 7 years to help you guys understand that autism is a medical condition, and the more we treat it medically, the more you're going to be able to help your child. So we record our podcast, we record our podcast live currently on our Facebook page. We're going to be switching over to recording it on our Instagram page, but you can take part in a live recording of our podcast every Thursday, 12:15 p.m. Eastern Standard Time. I take my lunch and we pick a topic about autism, and I want to explain it to you guys so you can understand, is this going on with my child, and what can I do about it? Because the ultimate goal of our podcast and of my practice is to help your child recover whatever delays they have, whether that be language, whether that be behavior or sleep, you name it. We want to help your child recover to be neurotypical, age appropriate, and go and live an independent, amazing life. So today's podcast topic is going to be motor skills. Okay. So motor skills are an issue with some of our kids, and there are different motor skills that will actually affect different kids differently based on what's going on internally and medically. So that seemed pretty awkward statement, so let me kind of explain it. When I talk about motor skills with my patients, okay, and I've got a telemedicine practice, I see patients all over the world. When we talk about motor skills, this is the usual pattern. Excuse me. The usual pattern is the first 12 months of life, you're going to develop pretty typical gross motor skills. Okay. So you should be crawling at a usual time and rolling over at a usual time and probably even walking at a usual time. And walking normally happens somewhere between 11 months and 13 months ballpark. Okay. So those gross motor skills are usually on track. So, and I hear a lot of patients, tell me when I'm talking about their child and how they got developmental delays or autism, they usually comment, boy, those first 12 months seemed fine, and he was crawling and he was walking and yada, yada. And that's usually the case. Let me say this though. If you have a child who the first 12 months did not develop normal gross motor skills, that being the crawling and the walking. Now, some kids don't crawl. Some kids go, boom, straight to walking. In fact, I talked to a patient yesterday whose child walked at 9 months, didn't even crawl. They're like, we're just up and going. Okay. So if you're missing those gross motor skills the first 12 months of life, please, the first thing you do is get genetic testing. Okay. It is normally genetic conditions that cause gross motor skill problems. So I want to make sure you do that. Now, if you're unfamiliar with genetic testing for autism, go onto our website, Spectrum Awakening, and we've got a free ebook about genetic testing. Okay, so download that, take a look at that, and it'll help explain what you should be getting. Okay, so the gross motor skills usually pretty on track. Your child should be able to, run around, kick a ball, climb the stairs, bounce on the trampoline, bounce on your couch. Those are the gross motor skills that we are looking for. And those are, again, pretty typical with our kids. When I say gross motor skills, I don't mean disgusting. I mean the motor skills of our large muscles. And that's running and climbing and jumping, that kind of thing. Okay? Fine motor skills, which are just smaller muscles, are normally what's affected by our children. Okay? So those are the muscles of the fingers. Okay. And so when our kids have problems using utensils, when our kids have problems writing, okay, a lot of our kids, instead of, using a crayon or a pencil or a pen like this, they'll grab it like this. Okay. Because what I'm showing you here, in order to do this, you use the muscles of your arm. Those are big muscles. When I do this, I'm using the muscles of my fingers. So a lot of kids have problems with this kind of manipulation, whether it be, again, crayons, pens, pencils, utensils, shoelaces. Those are fine motor skill issues. All right. So those motor skill issues are often more problematic with our kids on the spectrum. Okay. So what I normally would expect, jumping, running, bouncing, climbing stairs, fine. the hand holding thing's more difficult. That's classic and typical for autism motor skills. Okay. As I said before, and I want to make sure you hear, and somebody just put a comment that, let's see, Tatiana said, my daughter didn't crawl, just started walking at 12 months. That's fine. That's totally fine, Tatiana. Should you do genetic testing? Maybe, maybe not, but not based on that. If you're walking at 12 months, I think you're fine. Okay. And some kids just skip the crawling part. I don't know why, but it is what it is. All right. So that's what we're looking for. We're looking for motor skill issues, like the fine motor skills, definitely the gross motor skill problems. So if your child does have gross motor skills, that's a big red flag for me. Fine motor skill is much more prevalent. Another thing to look for when we come to motor skill issues is the muscles of the eyes. Now, a lot of us don't think about it, but our eyeballs have 6 muscles on each eye. That's 12 muscles together. And those muscles better be working simultaneously. Okay, if this eye's going left, that eye better be going left. That eye's going right, the other eye better be going right. Okay, or else our eyes are doing this. We start getting double vision, we start getting nauseous, and we only want to look out at things with one eye because 2 eyes is hurts. It hurts to see that. So if I only wanted to look out at something with one eye, I could do this, or get ready for it, I could do this. How many of your kids are the side-eyers? Because that side eye, when I side eye something, I can look at something in great detail with one eye because I'm not able to focus with 2 eyes. All right. That's another sign that a lot of our kids have. And again, talking about my telemedicine practice, I had a patient yesterday who they showed me their child. Their child lines up cars on a table and then runs past them doing this. Right? He wants to look at them just with one eye. This is another sign of fine motor skill problems. It's a fine muscle, a very small muscle. Okay. So if you're seeing these motor skill issues, these are normally from a problem with having enough energy to maintain that contraction. Okay. If I hold my pen like this, it's pretty easy to do that. That's a standard position for my arm. Okay. But if I want to take my hand and start doing a lot of different things with it, this is a lot more energy. This is a lot more muscle work than this. Okay. So when I think energy, the part of the body that makes energy is the mitochondria. All right. Now you remember from high school, mitochondria is the powerhouse of the cell. What does that mean? Okay. Mitochondria are the parts of the cell that make energy, period. Okay. We take food, we take air, we take water, we turn it into energy. Okay. That energy powers everything. Powers our heart, powers our muscles, powers our brain development, and powers our immune system. So another place to think about all of that, but again, I want to talk about muscle strength again. Another part of the body that has muscles that we often forget is our colon, our intestines. All right. We put food in this hole and poop comes out the other hole. But how does it get from A to B? It's got to be pushed. This isn't just gravity. It just doesn't fall that way. If it did, we'd turn upside down and would fall the opposite way, which would be pretty gross. So there are muscles along our entire gut, esophagus, stomach, intestines, colon. The whole thing has muscles to push it through. And our kids that lack that mitochondrial function that they should have, that lack energy, are going to have these muscle problems. They're going to have low muscle tone. They call that hypotonia. Low muscles in the eyes, low muscles in the hands, low muscle strength in the colon. So our kids who have really stubborn constipation, another sign of motor skill issues because it's a muscle problem. Okay. So I mention those things and explain those things because I want you to look for those things. Okay. Does my child have really chronic, stubborn constipation? Even though I give them, I have patients on Miralax and magnesium and castor oil and you name it, and they're still constipated. Okay. Severe cases like that, kids who have the side eye view, the low muscle tone, the fine motor skill problems, and kids who have chronic gut infections. Because the mitochondria, very prevalent in the gut, are required to produce energy for the immune system of the gut. So our kids that have these chronic infections, yeast infections, mold infections, parasites, can't get rid of it, okay? Those are the kids that have the mitochondrial issues. So whenever we see these motor issues, whenever we see immune system dysfunction issues, we've got to start thinking mitochondria, because that's the part of the body that's causing these issues, So what do we do from there? Okay, I see these issues in my child, and now I know to think mitochondria. Now what do I do? Okay, there's two things you can do. Number one, test. Number two, just treat. Okay, so if you're interested in the testing, there's two major tests to identify. Okay, the first major test and the most popular is called the organic acid test. That's also called an OAT test. And the organic acid test is a screen for mitochondrial disorders. It's a urine test. It's simple. Every lab in the world does it. Okay. There are specialty labs like Genova that do it, Mosaic that does it, but every lab around does it. So for my patients here in the US, I'll order organic acid test through Quest or through LabCorp, put it through insurance. We're at a hospital. Okay. Because everybody does these tests. So organic acid test is the number one test to screen for mitochondrial issues. All right. Next, the other test that's out there, which is a newer test, is called the MitoSwab. Now, the MitoSwab test is a cheek swab. So you get a Q-tip, wet with saliva. And what that test does is analyze the function of different parts of the mitochondria. Okay. That test is not available anywhere but the lab that does it. And that test is not covered by insurance. So, but again, so you know what's out there. I usually just do the organic acid test with my patients. We order it for any of the patients in our office, whether that be here locally in the US with regular labs, or we ship test kits internationally. We want to make sure we get it done. Okay. We do have the organic acid tests available on our website, Spectrum Awakening. So if you want to get one, you can do it through us. When you order a lab test through us, I get the results. I make the interpretation. I write out a written description of what's going on and what you should do, send that to you so you have your results and a guide of where you should go with those results. Okay, so that's step one, that's testing. Now, you don't need testing results to start to treat. If you've got these symptoms that I talked about, why not go ahead and try something, okay? Because there's really no downside to trying that stuff anyway. So what do I do to treat mitochondria? Let's get into the science. All right. So we're going to be reviewing science. And for those of you who watch our podcast or Facebook Live, whatever you want to call it, know that we are heavily focused on the scientific research about autism as a medical condition. Now, we do prefer natural treatments over pharmaceuticals, unless the pharmaceuticals are necessary, which sometimes they are. But we can combine science and natural therapies. And I know in today's day and age, those two things seem to not connect, but they do. And that's what we're going to review today. So, all right. Number one, let's just go through our research. All right. So I have to flip the screen around because Facebook is changing the way they do things. So here we have mitochondrial dysfunction in autism. A suspicion of mitochondrial involvement in autism can be traced back to 1985. Long time, guys. Further studies suggest that children with autism and mitochondrial disease have certain characteristics, such as fatigue, gastrointestinal disorders, neurodevelopmental regression, seizures, and motor delay. Mitochondrial function could affect a much higher number of children with autism, perhaps 80%. Mitochondrial dysfunction may be associated with environmental exposures and neurodevelopmental regression. Several treatments that target mitochondria, such as carnitine, we're going to talk about that a lot, and the ketogenic diet can help. Okay, so let me just switch the screen around. And again, pretty straightforward abstract. Mitochondrial problems cause a lot of issues. Here's the symptoms that they cause. Many kids have it, and a couple treatment ideas. Number one is carnitine, which we're going to talk a lot about. Number two is ketogenic diet. Ketogenic diet basically means get rid of the carbs and add the proteins and fats, because mitochondria will actually produce energy differently using proteins and fats versus carbs. And so heavier on the protein and less on the carbs can help. All right, let's continue. Hold on a second here. All right, next. All right, we have mitochondrial dysfunction in autism. Clinical aspects of mitochondrial dysfunction in autism include unusual neurodevelopmental regression, especially if triggered by an inflammatory event. I think we've seen those when you go in the doctor's office. GI symptoms, seizures, motor delays, fatigue, and lethargy. All right. Let's talk about that carnitine, which is one of the #1 treatments for autism and mitochondrial issues. All right, effects of carnitine in patients with autism. Carnitine is an amino acid derivative, plays several important roles in the central nervous system and for mitochondrial metabolism, okay? Beneficial effects have been reported using carnitine in autism for intellectual disability and muscular strength. There are side effects observed at doses of 200 milligrams per kilogram a day, which are just GI symptoms and a skin smell. Doses of 50 to 100 milligrams per kilogram a day are generally well tolerated. All right, so good introductory research on carnitine. They use it in kids with autism. They see benefits. How much to use? Well, if I have a 50-pound child, that's a little over 20 kilos. And so if I was doing 20 kilos at 100 milligrams a day, that's 2,000 milligrams a day. And that's pretty typical for what I normally recommend. So you can go higher than that, you can go lower than that, but I agree with the study about the side effects. You can have some GI discomfort, okay, mostly pain. But some people get a real fishy smell on their skin. Now, I've talked to a high-level autism doc in the field about this, who is a specialist in mitochondrial issues, and he says that the fishy smell on your skin is actually from a bacterial dysbiosis. So there's certain bacteria in the gut that shouldn't be there, and if you have a lot of them, they take that carnitine and consume it and convert it into something else, and that something else makes our skin smell fishy. All right. So if you've had carnitine, you have this fishy odor on your child, look for a bacterial infection in the gut. Pretty cool. All right. Next, we've got, okay. Here we go. Bada bazing. All right. Biomarkers of mitochondrial dysfunction in autism. And live shouts out to Dr. Fry, Rossignol, and Nicole Rincon, who's an APRN with Dr. Rossignol. Great autism docs. They worked on this study, biomarkers of mitochondrial dysfunction in autism. You're going to find abnormalities in lab tests of things like carnitine, ATP, CoQ10, genetic problems with your mitochondria, and they were all associated with autism severity. Treatments targeting mitochondria, particularly carnitine and ubiquinol, are beneficial in autism. Okay, I'll get back to that in a second. I wanted to show you this study just because of how old it is. This is 2004. This is 20 years old, talking about carnitine deficiency in autism, and that a mitochondrial defect may be the origin of the carnitine deficiency in these kids. We've had this research for decades, and it takes so long to get this information into the medical system. So even though we've got 2 decades old research on autism and vitamins and physiology, it's not something that's gotten into the mindset of your pediatrician. It's just not there. That's why you got to go see an autism specialist, because they know this stuff. All right. Going back to the other study, they talked about interventions, carnitine and ubiquinol, and they also measured something called ATP. Okay. Ubiquinol we'll get to. Ubiquinol is the fancy word for CoQ10. So there's many nutrients that can help the mitochondria. Carnitine's the big one. CoQ10's another. Another thing they mentioned is ATP. Now, ATP is the molecular form of energy the mitochondria produce. So we eat food, we breathe air, we drink water, and the mitochondria take it all and turn it into energy, like magic, right? That energy molecule is called ATP. Now, you can get ATP as a supplement, but it's really hard to find, all right? We have it. And so I'm going to be showing you the supplements that we have for mitochondria, but you can get ATP, I know it's backwards, as a supplement. It's difficult to find. We do carry it. And one of my pet peeves is that there's a lot of mitochondrial supplements on the market whose name includes ATP, right? But they don't actually have ATP in it. You've got to look at the ingredient list, okay? You look at the ingredient list and it says there, ATP, period, all right? So just watch out for that. It's the little marketing scammy things that kind of get on my nerves. All right, let's keep going. I see a lot of great questions popping up. Okay, autism and carnitine. Autism onset can be connected with various factors such as a carnitine deficiency. Some people with autism seem to have carnitine metabolism disorders, and for these patients, a dietary supplement with carnitine is beneficial. Okay, that's why we have carnitine in our multivitamin. Okay. Ubiquinol improves symptoms in children with autism. That's CoQ10. CoQ10 improves symptoms in children with autism. CoQ10, supportive therapy, Improve symptoms such as communication with parents, verbal communication, playing games with other children, sleeping, and food rejection. Hey, that food rejection is pretty big, you know. Again, I was talking to a patient today, and I said, hey, you know, I'd seen this patient a couple months ago. I said, let's try these supplements, X, Y, Z. And I, you know, talked to them at their second visit, like, how are things going? They're like, yeah, he wouldn't take them. And, you know, these picky eating kids, I get it. It's hard to get stuff in them. I understand. But what if CoQ10 could help? This says 17% of patients take CoQ10 had improved food acceptability. All right. All right, a couple more guys, and then we'll get to some live questions. Next, creatine defects in the central nervous system. Creatine deficiency syndrome, characterized by intellectual disability, language delay, epilepsy, autism, and movement disorders, exist. Now, creatine, hold on, sorry, I'm trying to flip this. Creatine is different than carnitine, okay? It's also different from something on lab work that you'll see in your oat test called creatinine. So there's three words that are very similar and they get confusing. We're talking about carnitine. That's a protein that helps mitochondria. We're talking about creatine, which is another substance that helps mitochondria. And then something on your lab test that is called creatinine. Okay, very different things. So I want to make sure you get that. So creatine is another good one. The last one we'll talk about is a mitochondrial supplement called PQQ. That stands for pyrroloquinone. Pyrroloquinone, PQQ, improves abnormal functional development and social behaviors. This is an animal study, but PQQ is an essential nutrient with important roles in central nervous system development and function. Hello, guys. PQQ treatment significantly reversed abnormal social behaviors in these animals. All right, so as you can see, there's a lot of science and a lot of research behind a slow, poor functioning mitochondria associated with autism. How does it affect autism and what does it create? Well, mitochondria produce energy. We need energy for everything. And there are certain parts of the body that use energy a lot more, like brain development and tiny muscles, okay? And the immune system. So for our kids who have fine motor problems, who have chronic constipation, who side-eye things, okay? These are all red flags for me in my practice when families tell me these things that you might have a mitochondrial issue, okay? Where do we go from there, okay? You can test or you can treat. I'm of the mindset of if we're doing natural vitamins, let's just treat and see how they do, how do they respond, versus looking at a test and say, well, the test says I should try something to help my child. No, I want to help my child, right? So if you want to test, it's called an organic acid test. We have those on our website, okay? I like the one from Genova a little better than Mosaic, but if you're international, we do ship the Mosaic tests internationally. So that's option one. Option two, there is this other test called MitoSwab. We don't have it on our website, but it's out there and it exists. Then there's treatment. Again, you can start natural treatments just to see what it does. Let me see if this helps our child, okay? I mean, that's part of the reason Spectrum Awakening has a 30-day return policy. They'd rather you try something, see how your child does with it, and if you don't like the response, send it back, okay? 30 days, send it back for a refund, okay? It's important that we take advantage of all the time that we've got to help our kids. All right, so what supplements, what natural things are we going to use for mitochondria? All right, a lot of research on carnitine, a lot of research on some of the other ingredients like CoQ10, creatine, PQQ, and ATP. So these are the things that you want to make sure you give. You also want to make sure you use low number B vitamins like B1, B2, B3. Those are really important for mitochondria as well. That being said, a lot of kids get hyper or energetic on B vitamins, but not the low number ones. It's usually the B6 and the folate and the B12. Those cause the hyperactivity more than the B1, B2, B3, okay? So we've got a couple things on our Spectrum Awakening website that I use with my patients and you guys can get as well. As I mentioned, we have ATP as a tablet. Very hard to find, but this is molecular energy. It works really well on the gut. Okay, you're gonna take this, it's gonna get down to the intestines, really help that gut immune system, and really help chronic constipation and poop motility. Let's move this stuff out, okay? The other thing that we have is a combo of everything, okay? And that's called Mitomax. I know this is backwards, but Mitomax is our comprehensive mitochondrial formula. And I need my cheaters because the small bottles always have such small ingredient labels. But we have the low number B vitamins and carnitine and creatine and alpha ketoglutarate and ATP and NADH and CoQ10 and PQQ. So we really developed this to, try to have all of the nutrients that your mitochondria need, as well as including molecular energy together. So these are the kind of options that you'll want to use with your child if you believe there's low muscle tone, if you believe there's mitochondrial issues, or if you have an organic acid test or a mitoswab that say you should probably try something like that, okay? So you can do things individually, or you can do them combo all in one. So that's kind of where we're going. Excuse me, guys. Got a little, still got a little mucus left from the cold. That flu was nasty. All right. So those are kind of the guidelines. Let me get you the coupon of the weekend, and then we'll go over some of our live questions. All right. So live coupon for this weekend is Mito20. Mito20 is going to get you 20% off every supplement, every lab test, not just the organic acids, not just the Mito supplement. Every supplement and lab test on our website, 20% off with Mito20. I apologize, I didn't change the date. It expires this Sunday, which is the 30th, I believe. So expires March 30th, not March 16th. It expires this Sunday. If you want one-on-one help, if you want a telemedicine visit with me, go on our website and click appointments, and you can schedule an appointment with me right on our website. All right. So let's get to some of our live questions. That was very blue steel turn I just did there. So I hope that dates me. All right. I really want to do the blue steel look now, don't I? No, don't. All right. It's been a crazy day for me, so my mind's like chinchilla in it. All right. Let's get to the live questions. And we're going to be ending our podcast early today. We're going to be ending at 1:00. I'm actually recording an autism webinar for a parent series. And this is my first time. I'm going to be recording it in English and in Spanish. So I really want to make sure I'm recording a lot of this educational stuff for you guys in different languages for people who don't speak English. It's so American, so US. Like, it's English only. No. We got to help you guys where you're at. All right. Live shout outs to Rodney. He's always on. Rita. Hey, Doc. I've recently come across your stuff and so grateful to have found it. Sorry, this is a long one. We're from New Zealand. My son's 4 and regressed. I've read through your guides and listened to the podcast. Confused to where to begin. Do I treat gut detox or viruses before the Skowron solution? What do I do? His regression happened at 18 months, lost his speech. He's sensory, poor fine motor, frustration. We give him probiotics, Z-Lite, etc. All right, here's what I want you to do. Here's where you start. And again, for those of you who are new to Spectrum Waking, thank you for tuning in. Thanks for listening. Okay. I've been helping kids on the spectrum for 21 years. And this podcast is to help people who aren't my patients. I mean, I want to help everybody in the world who has a kid with autism, because these kids deserve a good life. So, this is me trying to reach everybody in the world. There's always an order to things. And I've written my free ebooks to follow that order. So if you don't have our ebooks, go to our website. They're absolutely free. There's a beginner's guide. There's an advanced guide. Download them. Step 1 is making sure you're not constipated. Fix constipation. Okay. Step 2, if you have behaviors, okay, if you've got aggression, if you've got violence, if you've got out of control hyperactivity. Now look, 5-year-olds are hyper. Okay. Boys are hyper. But if it's extreme, look for gut infections and then treat that. After that, I like to use the brain stuff. This is the Skowron solution. This is the high-dose folic acid, serotonin supplements. That really is my wheelhouse for a couple decades, improving language, behaviors, and sleep through that. But a lot of the behavior stuff is not going to improve on that if it's from the gut infection, because gut infections cause behavior problems. So that's why I say constipation first, gut infection second, if it's there, and the behaviors are there. If you got a good behaved kid, you don't have to do the gut infection stuff. I would just go to the brain stuff. And then you start to look for these other outliers. Like, does my child have mitochondrial issues? Does my child have toxicity? Does my child have hormonal imbalances or genetic things? So it's follow the ebooks and see if that helps. And there is a method to the madness in the order, because if you start detox before you fix constipation, you're going to get worse, because those toxins come out in the poop. And if you're not pooping, where are they going to go? Okay. And you want to treat gut infections if you've got behaviors, because if you're treating brain stuff, you're not going to see the improvements until that gut infection's gone. Okay. So I hope that helps. All right. Adriana. Hi, Adriana. Adriana sent some Facebook stars. Thank you, Adriana. Facebook stars are a way to donate money to a Facebook Live speaker. We take 100% of our Facebook star money and donate it to autism support groups, TACA, and Autism Hope Alliance. So it's going to a good cause. Annie, my daughter takes Mitomax and a multi. Would adding Power and Focus be too much zinc? You can test. Also, will too much folinic cause anxiety? Yes, it will. That's why we made anger management. Anger management is the supplement to reduce the hyperactivity from B vitamins like folate and B12. I don't know if it's going to be too much zinc until you test, but you also want to make sure you're getting enough copper with it. Zinc and copper balance like a seesaw. So you may want to just do a test and check your zinc and copper levels. Couldn't hurt. I would say short term, it's not a problem. Long term, you may want to test it. Adriana, we bought the Brown Long Train Multispectrum and Folinic, and my son is doing great. He's now doing 2 to 4 poops a day. He used to have a huge constipation problem, and that's our Brown Long Train. Francesco feels so great. He gained back his appetite. He wants to eat now that he's not constipated. Can I reduce the Brown Log dose? Yes. Thank you again. You're welcome. I'm glad it's working. That's what we have. All right, Britton or Breton, what are your thoughts on the Nemechek protocol? So it's usually my policy to not comment on other physicians' treatments, because they've created those because that's what works for them. I do something different because that's what works for me. I see people, what I do see commonly with Nemechek is a lot of behavior issues along the way. And those are from die-off reactions. And Nemechek protocols treat gut infections. That's what it does, okay? And some nice omegas. So I think there are better ways to treat gut infections than just using inulin and omegas, okay? But again, different docs do things their way because that's what they see works. Adriana, we'll do a stool test with you guys soon. Sounds good. It's on our website when you want. Tatiana, my daughter didn't crawl. She walked at 12 months. Yeah, I did that one. Jeannie, I have to catch today's replay, but stopped in to say I appreciate you, your passion, your wisdom, and to encourage us to move forward and to not lose hope in the journey. Thank you. Hashtag Dr. Skowron rocks. Jeannie, thank you. And I know you're always on and you're always watching. You're always helping your kids or grandkids. I forget, Jeannie. But you're welcome. I love what I do. I'm lucky to find something that I like doing. Jasmine, I was reading a study stating that creatine is better for mitochondria problems than ATP. Excuse me. I think it's very individual. And I think it's about shotgun approach. Let's try a little of everything. But you can always high dose approach on different nutrients and see what works for your child, because they're all different. So creatine may work better for one kid. ATP may work better for another. Carnitine may work better for another. CoQ10. You don't know until you try, or you shotgun them all. That's why we made this. Braxton, my son's motor skills were perfect until regression, and then he's cerebral palsy-like. Is this normal? Well, it's sadly all too common with autism regressions, okay? Because, as one of these studies said that Dr. Fry wrote, an inflammatory cause of mitochondrial problems, okay? What could have created inflammation during a regression that perhaps caused a problem with the mitochondria? I think we all know that answer. He uses both of his hands very good, but it's hard to hold a pencil. That's the fine motor skills. So typical. Angela, we're trying to do superfolinic acid. It's affecting sleep. We started at 1/16 teaspoon. Add in our anger management, Angela. And I love so many of you have tried our new high dose superfolinic acid. We've actually run out of stock twice, and we're trying to make more. My producer told me possibly Monday. So we'll put an e-blast out when it comes back in and put it on social media. Let me give you a heads up though. I've got it. Where is it? I got it here. Here's our superflinic acid high dose. It's like a potato chip bag. Okay. You're going to get an amount and you're going to look at it and be like, wait, that's it? So don't be surprised at the potato chip bag effect of this stuff. There's 3 reasons that happens. Number 1, this is a powder and it's not capsules. Okay. When you have a bottle of a similar size like this, okay, that's capsules, so much space is taken up by the capsule and by the empty space in between as they're trying to fit. So if I emptied all these capsules, you get a very tiny amount of powder. And we need to make sure the bottle's big enough that you can read the label. So if we had a small bottle, can't read the label, we could fill the bottle up and then it would be like 3 times the price. So don't be affected by the potato chip effect. It's because it's not caps, and it's because we want the font big enough and we want, affordability or a good price point for you guys who wants to spend $500 on one bottle, right? Yes, but Angela, we created our anger management supplement to help with those side effects of B vitamins. Zoe asked when it would be in stock. My producer said Monday. I sure hope so. Jasmine, you described my daughter in the first 10 minutes of the podcast. How are mitochondrial problems connected to speech? Again, energy. If the speech center in my brain doesn't have enough energy to develop, it's not going to happen. That's it. Plain and simple. Sheila, I'm going to order the flinic acid. He's never taken it. Should I order the high dose or regular one? Start with the regular one and then go up. He's extremely dysregulated at school, doesn't want to go to school, screaming at school, covering his ears. Go with a gut. Go gut first. This is gut behaviors. Okay. You can get our yeast mold bundle. You can get a stool test, either one, treat or test. I don't care. But do that before you do flinic. I think you're going to get hyperactivity on the flinic. And I always tell people to start with a low dose. I also wrote a free ebook on the flinic and dosing instructions. So if you want to download that free ebook, please do. All right. Kieran, what do you think about peptides? They're becoming more popular. I've only had like 2 patients do them and they like them, but I don't know a lot about them. So I need to learn some more. Adriana, your products are saving my child. It's chronic constipation. We're in Canada, but we'll definitely do the stool test and to analyze more. And if you want our stool test, Adriana, we do ship the Mosaic test kits international. Again, I prefer the Genova, but those we only do within the US. Jessica, hey doc, I'm wondering if you've had any insight on zeolites. We have a new product. Do I have it here? No, it's not here. Called Detox Dynamite that includes a zeolite. And I think balanced with other detox binders is very good as a group. I've seen zeolites do well for my patients and do poorly for my patients. Also, wondering about the safety of antibiotic injections. I don't think there's any difference in safety versus a neurotypical person. All right, guys, I am going to answer a couple more questions and then wrap up early, again, because I'm recording a parent webinar. Lena, we're on mitochondrial protocol, but seeing no results. What could preventing this? Another medical issue. So maybe it's not mitochondria causing the problem. Is it gut infection? Is it brain chemistry? Is it genetics? Start thinking of if a treatment isn't working, and this is a general answer. The treatment isn't working after a couple months, it's not going to magically work. Okay. Nobody's like, hey, let me do this thing for 5 years and then it'll work. No. So if the treatment doesn't work, you're barking up the wrong tree. Stop it and switch to something else. Okay. Sarah, do you recommend, good question, Sarah. Do you recommend L-carnitine or acetyl L-carnitine? I recommend both. Now, in our MitoMax comprehensive mitochondrial formula, we have both. We have acetyl L-carnitine and L-carnitine. I think they're very similar in effect. The acetyl form tastes a little worse. It's a little bit more bitter. Acetyl-carnitine is what you see a lot online and in the research because it's the active form. But there are some vitamins, and I find this really intriguing. The active form can't get absorbed. The active form works in the gut. The active form has to become inactive to become absorbed into the bloodstream and then reactivated through acetylation in this case. So that's why my standpoint on this stuff is try both. Let's blend both and see what works. But the acetyl is definitely a more sour taste if you're taking powders. Armando's always on. My son usually gets a fishy smell in his stool, not his skin, every time he takes carnitine. Is that normal? No, but it's common, but it's from dysbiosis. So we got to go to the gut, Armando. Lena, what markers in the O test indicate mitochondrial issues? Oh, there's so many of them. I can't list them right now. If you're doing one of the out of the box organic acid tests like Genova or Mosaic, they'll tell you. If you're just using Quest or LabCorp, you've got to know what you're looking at. I should probably do a educational piece just on the O test. That might help. Maybe I'll do that next week. Oh no, next week. Oh guys, hey, heads up. I forgot to mention, next week is the first week of April, okay? The first week of April and Black Friday is the only time Spectrum Awakening does its 25% sale, okay? So if you want to take advantage, next week we'll start it. And next Thursday, I'm just going to do like a review of everything we've got so that if you want to take advantage of the 25% sale next weekend, do it because they ain't going to happen till Black Friday. Adriana gives CoQ10 and Brussels sprouts to their son. Adriana takes your multivitamin, brown log folinic. Next step's the stool test. Can't see a multivitamin probably is at best for my granddaughter. She has an iron sensitivity, and a report says to stay away from supplements with iron in them. Well, you can't see that's going to be a balance. You don't want to over iron, but you don't want to be anemic. So I think it's important to have the right amount, and certain people not have excess. But I wouldn't avoid it to the point that you're anemic. All right. Carol, what treatment would you recommend for a gut infection? Take a look at our yeast mold bundle. Luce, thank you for your time. Luce was a patient today. Looking forward to continuing transformation with my little one. Me too, Luce. I think she's going to do great. Suda, my 22-year-old son overeats too fast. I do that too. He doesn't gain weight. All right, that's a problem. You know, 22-year-old eating enough for 5 people and doesn't gain weight. He's not digesting his food, okay? I want you to take a digestive enzyme. We've got a couple on our website. There's a lot over the counter, but digestive enzyme is the way to go. All right. I'm going to wrap it up there, guys, only because of time. Sheila asks if the ATP supplement can be crushed. Yes, it can. Does low muscle tone indicate a mitochondrial issue? My son cannot do a monkey bar. Yes, 100%. Yeah, that's what you should do. Okay. I'm going to wrap up the questions there. I know I didn't get to all the questions. We're stopping early for time, but make sure you tune in next week. We'll answer some questions next week. So here's a summary. Okay. Motor function issues are common in our kids with autism. More often with fine motor, that's small muscles like writing, using utensils, eyeballs moving together, your gut and moving poop out. So if you have low muscle tone and these fine motor issues, think mitochondrial problems. If you've got gross motor issues, which means I have problems climbing stairs, that is a big red flag, and you need to get full genetic testing, either with our website or your doc. Doesn't matter, but that's a red flag. What do? If you want to test, you get an organic acid test. If you don't want to test, you just want to treat, you're going to use supplements like carnitine, CoQ10, ATP, NADH, PQQ, B1, B2, B3. We've got all of those wrapped up in one with our combo called Mitomax. Or if you just want the ATP with the molecular form of energy, which works really well in the gut, we have tablets of ATP as well. So you've got options, you've got knowledge, you've got testing. And again, the organic acid test you can do with your doc. You can get it from our website, either one. But you know where to go and what to do. And there's a little bit more information on this on our free ebooks on our website. I think this is in the advanced guide just a little bit, but it's a good way for you guys to kind of keep all this stuff in mind while you're helping your child. So thank you again for tuning in. Thank you for sharing all of this with other families and friends. I mean, there's hundreds of thousands, if not millions of kids around the world with autism. And I want their parents to know there is hope. There is something that you can do and try with your child that could work. Okay. So make sure to pass that around. Coupon of the weekend, again, is Mito20. That gives you 20% off any of our supplements or lab tests on our website. Next weekend's our big autism awareness 25% sale. It's only April and Black Friday, so make sure you take advantage of that. Have a great weekend, and we'll talk to you soon. See you, everybody.